Hey everybody, welcome to part 2 of my conversation with my friend Dr. Catherine Fyans. We are going to continue to chat about things that we talk about when we're together, things that we are passionate about, things that we feel are important to be discussed at this point in time, and we're letting you in on that conversation. So it's really just, Catherine is still, she's a medical practitioner, she's still practicing. I was a nurse for a long time. So really it's just wanting to, we're not advising, we're not telling you what to do, but we want you to be informed and we want you to be empowered. And if something that we chat about helps you in conversations with other people or helps direct you in your own research, then fabulous. So hi everyone, as you come on, let me know if you can hear me okay, if all's well with the sound. I'm going to ask Catherine to send a request and I'm going to bring her on in a minute. We are going to have a talk about, hi Marianne, we are going to have a talk about, there are 3 current ads that are doing the rounds that I want to have a talk about, and then they're going to lead me into questions that I ask Catherine that I'd love her to speak on from not sort of in her role as anything particular, but it's great to get the input from somebody still in the medical system. So Catherine, if you can send me a request, then I will let you on. How is everybody? Oh, beautiful. Okay, I'll be on in a second. I hope you're all well. I hope you're all doing okay. It's nice to have you join us. Oh, hi, Catherine.
Hi, Sabina. How are you?
Yeah, good.
Yeah.
How are you today?
Fine, good. Had a lovely walk in the forest, so yeah, I'm good. Hi, Marianne. Hi, Amy. I just saw some names I recognised, so
great. Hi,
a shout out to you guys. Yeah.
Really appreciate it. And so, as I've said, we are just 2 folks, one who's still in the medical profession, one who used to be, who are friends, having a chat about things that we feel are important at this time. And we hope that by letting people join in on that, listen in on that, that we empower them and help them feel part of a wider community.
Yeah, exactly. So I'm not representing the medical profession. I'm just a person with some viewpoints. I just happen to have that medical background as you do, Sabina. And we're certainly not giving medical advice. And I really encourage people to do their own research and make their own conclusions particularly. So take or leave, you know, what we say, and if something's useful, take it. If not, because we're discerning adults after all, and that's really the name of the game. Yeah.
That's right. So I was just saying before, there are 3 ads that are currently doing the rounds that I would love to bring up. I'm just going to describe them, and then I'm just going to sort of spark some questions from that and see what you would like to speak on that.
Yep.
I want to start off with the ad that is currently doing the rounds with Scotty Cam. Starts off with Scotty Cam, goes into, it's a Channel 9 ad, whole heap of celebrities, well, you know, of varying degrees.
The usual players, right?
Yep. The usual players, the very mainstream players, encouraging everybody to get the S word. I don't even want to say that word too often because I think that gets flagged too. So, you know, I've had mine, you can get yours, we can all open up, we can travel, life can be wonderful once we all have this. This is the general gist of the ad for anybody that hasn't seen it. At the end, Scotty suggests that you talk to your doctor about this. Now, you and I know that that's an interesting topic, because if I were, as a patient, if any of you watching were to go off to your general practitioner and ask them about the shot, that might be quite a one-sided view. And that's not necessarily the view of the person that you're speaking to. So I just wondered
Yeah.
what you might like to add, any thoughts that you might have on somebody that thinks, that watches that ad and goes, okay, I'm going to go and have a talk to my GP. How well informed might they be after that conversation?
Well, starting with the ad, I did see it once with horror, I must say, because the amount of psychological manipulation behind it is immense, as you would notice. And the whole language in pretty much was, well, we will get out of lockdown if you do the right thing. Yeah. If you take this medical device, can I call it that?
Yeah.
Is that yeah?
Yeah.
If you have the medical device.
Yeah.
So notice how the narrative has changed over the year and a bit from you will get a wicked microbe and potentially have horrible consequences. That's been the message. To you will get your freedom if you oblige. And I think that's quite interesting, that's been very slowly dripped in over the months, that if you want to basically live normally, if you want to travel and move around and go to venues and shops, etc., this is what you need to do.
Live your life, live your life thing.
Yeah, basically, if you want to live your life, this is what you have to do. So it's changed from, this is a terrible disease out there that might get you if you don't do this, and that's a whole nother discussion, I might add, when you look at the trials of these devices. Anyway, so that's a little kind of add-on at the end. Go and speak to your doctor. It's more or less saying, well, now the responsibility is on the busy GP who's, got 10-minute consultations and has to essentially look at informed consent. Informed consent is interesting because really that is looking at the pros and cons of any medical intervention. Yeah. And that's always been expected that is what we do, okay, across the board. That all changed last year. But there's so much information about these devices that it does take an awful lot of time to wade through the scientific data, the trials, etc. So really informed consent could be an hour's conversation for someone who's informed, maybe summarised everything.
Particularly for a drug that is an experimental drug that's still in its trial phases, you would put aside an hour to sign somebody up for a trial normally.
Well, yes, exactly. So it's quite intriguing that it's, we'll pass the buck to the busy GP who will just say yes or no. And, the reality of a busy general practice is that they often don't have the time. And I might have mentioned this last time, and that's not an excuse, it's just the reality.
Yeah.
And also, as we know, there's exceptionally heavy influence on what we can and cannot say anyway. So,
are you happy to just, or would you like me to mention that?
Well, you go ahead and I'm happy to jump in.
So people may not be aware, the same goes for all nursing staff, all medical staff that are registered underneath the organisation, the registration body, have been informed that they are not, I'll just talk about nurses, they are not to speak negatively about VXs at all. And that if they are caught doing that, they can lose their registration. And it's my understanding that it's the same for doctors. Yes,
and other groups of healthcare practitioners.
Right.
Because there are other groups under that auspices of the regulatory bodies, and that includes chiropractors, acupuncturists, and, and a number of others. So basically we have been officially told that we will be, quote unquote, punished, and that term was used, and subject to severe disciplinary action, whatever that is. The mind boggles, but anyway, if we don't follow the narrative as is expected from those bodies. So
where Scotty Cam leaves off, if you don't pick up the next part of the jingle, if you don't sing the next line in the jingle correctly, then there are consequences.
Exactly, true. And it's not just the patient-doctor relationship, it's also via social media. where we don't have the freedom to express things. And I personally know doctors who have been pulled over the coals because they've expressed an opinion. So we're no longer allowed to have a debate or make an observation or have an opinion. And really, to put it quite frankly, the thought police are well and truly here. And this is very Orwellian. Yeah. And, I'm taking a risk saying that, but look, I can't not say it. Because,
where I love that you're willing to talk about this is because a lot of people aren't aware that their doctor is really in a catch-22 situation where their GP, whoever their GP is, may want to be more open with them, but is in a bind. And I just want people to know that, because you have your one group of people who culturally or due to their age, whatever, revere the doctor as though they're God, and would never question. And so you've got that group, and I think it's important to educate that group that, well, listen, your doctor is really in a bind as to what they can tell you. And then you've got the other group who are having conversations with their family members and giving them all this information. I get this so much. I sent my, relatives all this information, and they said they weren't going to have it, and then they went and spoke to the GP, and the GP talked them into it. So it's important for people all around to understand that you've got people who haven't had the time to really look at all the information that gets sent to them, the probably hundreds of pages.
And it takes time. It really takes time.
Yeah. So a lack of time, a lack of being able to speak freely and openly about sharing actually what, so you've got some things going on here beyond somebody that's fully in the system and fully part of an agenda or asleep themselves. They may be more awake than what people realise.
Yes. It's quite interesting because the very same regulatory bodies have always taught us that we have to evaluate the risk-benefit ratio of any medical intervention. That's absolutely has been expected of us, and so it should be, that we weigh it up and down. Now, we don't always get it perfect because, none of us have perfect knowledge, no matter how we try. But that is a reasonable expected thing. You look at the pros and the cons. Because the rules changed last year.
Right. Speak about that, and then I want to ask you a question. What changed?
Well, I mean, just as I said, evaluating the pros and cons, having a discussion, having an opinion, having a debate, because science is about debate, really. We want different opinions. We want different ideas. That makes it honest. Otherwise, it's dogma. It's quite frankly dogma. So what changed is moving from that to, no, you follow this narrative or else. It's disturbing. It's really disturbing.
Normally, if I was to go and see my doctor, they want to give me a reasonable amount of information so that I can make an informed choice, because if there was an issue with my doctor's guidance to me and there was a concern, obviously I could sue. And this is obviously why doctors have, indemnity insurance.
Well, not for these. That's the thing. No, correct. Correct. Yeah. So yes, exactly. And absolutely. And, I certainly don't want to, criticise my colleagues, not at all, because I do know the reality of being in that world, even though I practice quite differently now. And there would be a huge variation amongst the profession or any people of knowledge regarding these interventions, a huge variation. So it depends who one sees and their expertise in that area, that interest in that area. I don't think I've answered your question. Do you mind reading?
No, you have. Yeah. I think you've spoken beautifully about informed consent, that it was something that was valued, it was something that was implied, it was something that was, you had to have it because you could be sued.
Oh, yeah,
This is something that changed
absolutely.
at the beginning of last year. When it comes to this particular treatment, it is not something that can happen. I can't sue you. I can't sue anybody. And the time to really give informed consent and informed choices on something that is experimental clearly can't be done in 10 minutes anyway.
No.
But that people need to know their GP is currently, so is their nurse, so is their chiropractor, so is anybody that is registered in the governing body, has been told that if you do speak negatively about these treatments, that there will be consequences. I think it's great for people to know that.
Yes, that is true. And it actually changed regarding the indemnity in 1986 under Reagan with the Childhood blah, blah, blah Act. And from then was the company saying, well, you know, if we're going to be given these interventions, you have to promise us that we have full, we can't be sued, essentially. So that has continued from then. It's just been wrapped up.
The 1986 Act. I think if people look that up, the 1986 Act, they will find all of that information. That was the year that everything changed, and you could no longer sue the actual companies.
Correct. Yes, which makes it quite interesting.
Well, it makes the end of the ad saying, just chat to your doctor about it, a little bit different to what some people might think. So they're not necessarily getting a good chat when they do go and see the doctor. It's kind of, you know, you just do some of your own research maybe before you have that chat.
Well, exactly. And with no disrespect to my profession, this is why people are doing their own research. And this is what we're finding, is that the whole idea of an expert is really changing, because a lot of people are saying, look, I need to find out about this and spend some time looking at it. So I'm finding that, you know, the taxi driver has as much expertise as and maybe I do regarding some of these things, because they've really looked into it. Not everyone's going to do that, or, you know, might not want to do that, or don't have the time to do it. I fully understand that. But this is where things have changed too. And in a way, that is taking ownership of one's health. Because I believe, you know, one's ownership of one's health should be given back to the individual, with the healthcare practitioner being the, you know, the advisor and facilitator, maybe the advocate, but they don't own anyone else's health. Well,
that's a really good leeway into the next ad. Or the next sort of, so this one is on social media where I've seen it. It's from the US. I don't know if I think it's a snippet that's shown on social media, and it's a lady at a podium speaking at a podium, and she says, I've had the VX. I don't know what's in it. I don't need to know what's in it. Don't ask questions, just have it. And there's kind of some men in suits behind her that look doctorish and scientish, and they all kind of laugh and go, yes, that's right. So basically the take-home message is, do not ask questions. So what I wanted to ask you about that was, in general, I'm going to speak from my own perspective. Many years of working in a hospital, patients who ask a lot of questions quite literally are a pain in the ass, because A, you're busy, B, you know, you don't have the time often, but also the whole system discourages questions, because there is the hierarchy of people who know what's good for you, and you are at the bottom of that as the patient. So what I wanted to ask you was, I think a lot of people may have a misconception about how easy it is to ask questions when we ourselves are employed within the system, because there's a lot of judgment at the moment on nurses and doctors, and sort of saying, well, how could they do this? How could they be part of this? And in reality, a lot of them would have no idea. That, again, like you said, the taxi driver could be more well-versed and better researched, better, you know, more clued up than a lot of the medical practitioners. Because
look, I won't talk about my colleagues. I'll say maybe they know more than I do. I'll bring it home. Because
what I wanted to ask you was the whole encouraging of questioning What's been your experience, say, during your training? What's been your own experience of how easy is it to ask questions when you are employed in the system?
Mm. Well, let's put it this way. There are areas of healthcare and related to interventions and devices put in bodies where there's almost this is my perception, okay?
Yep.
So,
Yes.
well, there's almost a cone of silence.
From your experience.
Okay, my experience, there's almost a cone of silence that you just don't discuss it. End of story. You just go along with it. If you dare discuss it, you're one of those, pretty much, you know, and anti blah, 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 okay?
Right.
Particularly in this area, interestingly. And no one actually said you're not allowed to, well, they have now, but in years past, they didn't say you cannot discuss this. It's more of it's a collective mindset. It's in the field. If I can put it in those terms, you'll know what I mean by that. It's actually in the field.
I think most people listening to this will know what that means.
Okay, that you don't go there. And, you know, sometimes having conversations with patients who say, look, I don't know about this. You know, I don't necessarily want this for me or my child. It's almost put the cone of silence down. We don't want anyone to hear. And it's bizarre. It's when you step away from that and really look at that forcing current that makes us behave like that.
Yeah. It's
quite concerning. But because it's surreptitious, people don't notice it. They just go along with it, if that makes sense. Yeah.
Yes. And I think I'd like to speak at this point about, I wanted to talk about the difference between intelligence and knowing. Yeah. Because I think part of what makes it so looked down upon to ask questions, yes, there is certainly, it's almost like asking questions within a church. It's like, who's going to put their hand up?
Well, it's very similar. Because it's almost become a religion, and that's the energy behind it.
Yeah.
It is. Yeah. Sorry, I cut you off, but that's very relevant.
No, it is totally. And so I think what's happened is there has been this revering of intelligence and this looking down upon knowing. And so I've had so many people say to me in this time, since sort of that time last year that we all know about that time, why are my smart friends so dumb right now? I get asked that a lot. And my answer to that is that we have revered intelligence, and intelligent people don't need to ask questions, because asking a question when you're looking at intelligence implies that you don't get it. And so we've come to this point where I'm considered really smart if you can give me a slab of information and I just get it without needing to ask questions, without needing an explanation. I just say, okay, yep, I've got that. I get it, right? It's how we assess intelligence in school. It's how we assess intelligence during our medical training. I mean, my nursing or medical training. It's how we assess intelligence. If I write all of this on the board, do you get it? Can you then be tested on it without asking questions? Because whereas the patients that ask questions is a pain in the bum, the student that asks questions takes up time and is not as smart as the others. And so this knowing that we might have, even within the system, red flags, that feels off, that doesn't feel right, is kind of laughed at in a sense.
Yeah. Oh, yeah. Well, well, let's talk about intuition, because that's a dirty word in you know, where I come from. It's not in my world, but where, you know, my background. Yeah. And intuition is knowing without thinking. That's the way I see it. And it's really hard intelligence. Yeah. And this is what I am so passionate about, because, you know, I would love to bring this hard intelligence into the medical world. And sure, it's going to be in a number of people working in that world, and in some areas for sure. But overall, it's not, because it's not, it doesn't get the kudos, let's put it that way. Yeah. So we've also been trained away from that starting in primary school, I think, to honour the intellect and the left brain particularly, and it has its usefulness for sure, but at the expense of the heart and the right brain. Really, brain and heart should be working together with heart on lead, and the mind is meant to implement what the heart has decided. But we've got it the other way around. And when the mind is untethered from the heart, it's very, very clever in its justifications,
Yes.
you know, to fulfill its own agenda.
Yeah.
And related to that, and this has absolutely broken my heart, well, I won't use that terminology, it's really caused me a lot of heart pain, is witnessing these draconian, heartless, one-size-fits-all, fear-based, constrictive sanctions and restrictions, you know, such as the border crossings where parents are separated from children, people can't see dying relatives, people can't come into the country to farewell a relative who's dying. I just cannot understand how that happens. But to me, they're cut off completely from their heart. And so many good people are fulfilling these objectives.
Yeah.
And when you look around and even, you know, go into hospitals or airports, there's this almost military sort of energy, you know, and that's not healing.
No.
And that is not at all healing. It never will be. And fear is not healthy. So people, you know, think, oh, if we follow the rules and follow the sanctions and do the right thing, we will survive and be healthier. The opposite is true. And it's been very painful for me to see this and the absolute heartbreak of people. And there's just no empathy or compassion or understanding of the nuances and complexities of the human condition and health and well-being. And we forget well-being. It's all about survival. Okay, you're going to get this virus, which is completely disproportionate to the reality, utterly. But that's what's been drummed in. You will die if this doesn't happen.
Yeah.
You know, it's so out of proportion, it's ridiculous. And look around at what our world has become and the people who are upholding this.
Yeah.
And, you know, got their checkboard and saying, you know, the QR coding and all that. It is institutionalised insanity. Yeah. I don't care who gets me for that. That is what it is, and it needs to be called out. It really does. It's got nothing to do with health. That energy will never heal or keep people healthy.
Yeah.
I don't know if I've answered your question, but I just...
You have, completely. And actually, when you describe that so beautifully, what intuition is and how the heart must lead the mind, it actually made me realise how nursing has lost all of its caring. And when we did that when we sold our soul for the title of a profession. And also you mentioning intuition is so interesting. I want to share particularly one example that really comes to mind for me, because the minute you said intuition, I thought, do you know what? There has countless doctors' asses have been saved by nurses' intuitions. Because what people don't realise is the nurse is like the mum of the house. And she knows everything. She knows where everyone is. She knows
I so relied on that in my hospital years. There was always the great experienced nurse on the floor. It's like, and they just had the wisdom and the heart, and they knew what was going on. And particularly as juniors, we so relied on their wisdom.
What to do. Yeah. And
absolutely
people don't realise that. You know, you're looking after the patient and they'll say nothing to you all day, and then the doctor will come in and they'll be like, oh, I've had pain all day. And you say, well, you know. But what happens is that the doctor relies on the nurse to feed back to the doctor what is going on. And so often, particularly in post-operative care and in emergency, you would look at someone and you would say, there's something not right there.
Yes.
They're going to go.
Exactly.
They're going to code. And you would know they're going to code. And there wouldn't necessarily be anything that would give you that indication other than you just would know it. And sometimes people would come back from theatre. There was one case in particular where I just knew not to feed that patient. I knew he'd been back for hours. It was a young guy. And I just thought, no, there's something not quite right. I'm not going to feed. I'm not going to give him food. I'm just going to hold off. And
Yeah.
he was having a bleed, and he ended up having to go back to theatre that night. And I cannot tell you what told me that.
Yes.
And you know, I mean, that patient, what I'm saying is that nursing element used to really be there. And then it was, oh no, the intelligence is so much more revered than the knowing. You have to go to uni and you have to know all about ta-da, ta-da, ta-da. And nurses have lost a lot of what they love to do. This is not in any way to imply that nurses aren't intelligent. There's a lot of intelligence that goes into caring at the bedside. But it was the making it a uni degree, and it was the, you know, thinking more about the machine. I mean, you've got younger nurses now who will look at all the machines and go, no, the patient's okay.
Yes. Right.
And you're
hello,
like,
I'm on the bed here.
The
Yes.
patient is blue, lying in the bed, you know,
Well, this is why I don't like telehealth. And sure, you know, as a short-term thing, fine, but I don't like it because I actually like the person in the room because you can see them, you can get a sense better than across the phone. And the old-fashioned GP, maybe before the middle of last century, would have acted on their gestalt, like you're saying, you know, and other healthcare professions, not just within, you know, the Western medical world. They would have acted on their gestalt because they didn't have all that scientific information. It just wasn't there. So they would be using a very different sense. And I'm old school enough because I've been a doctor for 40 years. And I'm so grateful that I trained in those early years because I'm seeing this very differently to so many people who came through after that because, you know, we're on the wards in medical school and all of that. So, you know, the old-fashioned GP would have done the home visits and got maybe a jar of jam or something and sat on the side of the bed and held the dying patient's hand. Now, I'm not saying that doesn't happen now. I'm sure it does, you know, but it is different. And as you say, it's been trained to be different, and particularly since 1910, I might add. I don't know if we have time to talk about that, but that's really where...
I would love you to go into, if you're happy to, like, what is missing in the mainstream narrative when we're looking at mind-body medicine, when we're looking at intuition, when we're looking at intelligence and knowing. What is missing in the mainstream narrative? And I think you're speaking to that beautifully. So if you want to elaborate on that, go for it.
Well, you know, it's just my opinion. All right, it's just my opinion. The whole mind-body thing, well, I wrote a book about it because to answer that very question.
And
because
I'm going to give people the title of that book because
thank you.
No one that knows
I'm not trying to...
We know. Nobody that knows you would ever know you've even written a book. It's the best kept secret in the whole entire world. And you wrote that book a long time. Like, you wrote that book. This is not a new book. You wrote it quite some years ago.
Would have been 2016, the first edition.
Yeah. So the book is called The Wounding of Healthcare, From Fragmentation to Integration. Catherine is not here to talk about the book, but I would love you to know that she's written a book on this topic. So she knows a little bit more than the average person because you've done your research too to write this book. So, go for it.
Yeah, and I'm looking forward to reading yours, by the way. So I really did write it to answer that question. There's not a quick answer, but the way I see it, if I try and put it into a nutshell, is that the whole word of reductionist medicine and scientism has made us look at the body like it's a machine, separate from consciousness, okay? Yeah. And that thinking really, well, it started with Descartes. That's where the mind-body divide really came in, and it's, you know, been the dominant ideology in healthcare until this day, and it continues. So we might hear, oh yes, stress causes illness, but then that's where the conversation stops. It's much, much more nuanced and complex than that. But it's very hard to describe the mind-body connection in a Newtonian classical physics linear cause and effect way, because that's not how it works. Really, one needs an understanding of quantum physics, because those understandings underpin the mind-body connection. So we're looking at fractals and the hologram, so to speak. So the quantum field, which is complex, but in a nutshell, it's saying that there's a field of energy beyond, yet interwoven with the world of form. Yeah. So when I'm thinking of a mind-body connection, I'm looking at it through that lens, not the Newtonian linear cause and effect lens. And that's where I lose a lot of people. They just think I'm crazy and the conversation stops.
So where you might look, I just want to just explain to people what that kind of might mean in a feet on the ground kind of way. So whereas the mainstream narrative might be, okay, there's a disease here, there's an illness here, what are the symptoms, how do we suppress the symptoms, how do we make you feel better by taking these symptoms away? You're talking more about, okay, firstly, let's look at what are the causes that are a part of this, and let's deal with the causes, the deeper causes of this presentation that's before us right now.
Well, exactly. And it's not even causes, because it's concurrent. And Joe Dispenza talked a lot about this. He's saying mind and body is a state of being. So they're concurrent. They're feeding into each other all the time. But essentially it's saying our health is not separate from our life, our experience of life from day dot, including our ancestral history and also the collective consciousness. So what goes on in our bodies is not separate from our mind, which is related to all our life experiences. Yeah. So that's probably putting it in simpler terms. Yeah. And we know, for example, some people, there's always exceptions to the rule, but some people who might develop a cancer, there might have been something very significant in their history, their emotional history, 2 years prior. Or thereabouts. So, there are many, many, many examples of that. And I'm really intrigued to see what's going to unfold over the next couple of years related to what we have experienced during this time, because this is an almighty crisis that has affected everyone. No one's escaped this. Yeah. And really how we're dealing with it at a mind level is going to determine our individual and collective outcome, mind and body. So there's been so much focus on the now and survival, even though that is very disproportionate to the actual reality. We're not thinking a lot about 2 years down the track. No one knows what's going to happen to the world. We know that. But it's going to be interesting. So I suggest people do an awful lot of processing right now.
And like you said before, there are certainly some silver linings to the current situation that we're going.
Of course.
People are learning more about their immune systems than ever before. People are learning more about their own health. Well, some people are learning more about their own health than ever before. Mm-hmm. They're looking, their plan A hasn't been available to them. They haven't been able to go to the doctor. They haven't been able to go and have that surgery that they would have had or whatever. Mm-hmm. They're looking at other perspectives. So yes, we have this, we're going so far in the extreme of, we'll just look at this one aspect of everybody's health and bugger the rest of it. It doesn't matter what's going on around, doesn't matter what your mental health is, doesn't matter what your nutrition is, doesn't matter what your societal structure is. None of it matters as long as this one particular thing you test negative on this test.
Oh, it's so bizarre. It's so bizarre, and particularly when, with that kind of mind-body, or what I prefer to call conscious health sort of viewpoint. It's bizarre because it's such a myopic, one-sided emphasis on health. And it's basically shut it out, get rid of it, eradicate it, which is a complete misconception. Yeah. And it's, maybe I shouldn't say this, but the sanctions and the directives, they're infantile. They're absolutely infantile. Like we're hearing, okay, we're locking down with this and that. Tell us why. Like we're discerning adults. We have the right to know why you're making these decisions. What cycle threshold are you using on the PCR test? We would like to know. That will give us a better perspective of the reality of the situation. Why are we having a 3, 5, 20-day lockdown? What is the rationale behind it? And, I think, I don't even know where I'm going with this, but I've lost my train of thought, actually.
I think the interesting thing is that we spoke about this a little bit last time too, is that
Yeah.
I think the reason why they won't tell you how many cycles the PCR tests are run on is because if they start talking about that, people will realise that the questions that are being asked by the people who have done research and looked into things are valid. See, if I'm here doing a live, Catherine, and I'm talking about whatever I'm talking about, and every time somebody asks the question in the chat, but what about this? If I just ignore it, if I just completely ignore it, and then when I get asked about it again, I just say, oh, yes, you know, that's just whatever.
You don't need to worry about that.
You don't need to worry about that. Just rest your
just
weird
do what we say.
and just lock your doors. I think that's the key here, is that if I don't speak to it at all, then anybody that raises it sounds like a Fruit Loop. Because
Well, exactly. And getting back to what we're saying about this myopic single focus, completely ignoring all the other factors that impinge upon health and well-being, is just amazing. A classical example that I've seen quite a few times is people sitting in their cars with their mask on, and they've got the right to do that if they want at the McDonald's drive-in. So they're about to get their Happy Meal, yet they think having this thing across their mouth is going to save them. And it's really destructive message to give, because that is actually what, hopefully not the majority, what some people believe. If I just do this, wear this thing all day, I'll be safe from this wicked whatever.
Yeah.
And it's completely ignoring all the other factors that impinge upon our vulnerability and our immune systems and health. And not to mention
almost like when you say that, I mean, I have a visual. It's almost like somebody who's got some milk on the stove, and they're watching it and they're making sure. Okay, let's say someone's doing a white sauce and they're stirring it beautifully and making sure it doesn't burn, right? While behind them the whole house burns. And you're saying,
precisely.
You're saying, no, don't worry about that. I just need to make sure this white sauce doesn't burn.
100%.
It's like, it doesn't matter what anything else is happening in your health, as long as this perspective, this one little thing, we're going to focus everything on it. And in a sense, sorry.
And I heard, well, from a patient the other day that a healthcare clinic in Melbourne have decided they're going to wear masks forever and get all their patients to wear masks forever.
Yeah.
And it's like, what message are you giving people? Because I tell you what, if we don't trust our immune systems at a mind-body level, our immune system will respond to that and turn down. And I know this is part of the objective of all what's going on, but this is very concerning. Very concerning.
And really,
that we think
that to think about it. If I wear sunglasses every day, we all know this one. If you put sunglasses on, every time you're in the car driving, every time you're walking outside, you start to get so used to it that when you take them off, you are so sensitive to the sun that you can barely walk around outside without having them on. And you're saying, well, the same thing will happen to our immune system. It will start to kind of think, well, there's no. It'll be so underutilized.
Yes.
That it will either become hyperactive or it'll atrophy.
Exactly. And, you know, this is why people let their kids play in the mud, because it's honing their developing immune systems. And it's like a muscle that you need to exercise. You need to be in contact. This is herd immunity with a variety of microbes so that your body becomes resilient. And this is another thing I find very concerning, that we've become universally germ phobic to the extent that people are scared of the air. Okay, plenty of examples of that, rather than resilient. So what has happened is that, you know, it's been encouraged that we become avoidant, risk avoidant, contracted, fearful, scared, germ phobic, rather than resilient, robust, you know, and going out and engaging life. And that is a terrible message to give us, and particularly to our children. And I am so concerned about that population. What are we teaching our children? And it's such, you know, when people are in that deep survival fear, it's such a narcissistic state. And I'm not trying to criticize anyone. That's how the brain works, as a short-term ploy, so that we survive that immediate threat. If we're running from a tiger, we're not worried about our neighbour 2 doors down the road. Yeah. But this has been long-term now. And this is why people will turn away from some absolute abuses of power going on, as long as they have promises of safety, which is a complete illusion anyway. You know, safety is in here.
Other states in Australia are sort of not even really, you know, there's a lot of people in other states not. I have friends who are travelling around Queensland at the moment saying, you know, there's people up here who just think, well, Melbourne just aren't very good at dealing with this. And
well, it's quite Well, talking about Queensland. Well, talking about Queensland, and we'll talk about Melbourne first. Now, we've had the most severe, brutal lockdowns, and I'm not even going to get into that, but the effects of that are just so detrimental. Yet we're the hotspot. Now, like, if something doesn't work, you don't repeat doing it. Like, was it Einstein who said the definition of insanity is doing the same thing and expecting different results? But I heard, and it might be a rumour, that there's some interesting border things that are now happening in Queensland. That
no, it's not a rumour. It's
oh
happening.
Wow, it's happening. So this is Orwellian. There is absolutely no medical justification. It is madness. It really is.
Well,
it just is.
Madness and no medical justification takes me to my third ad, which is. And everybody who's asking, will I be saving this? Yes, I will. So the third ad is from South Australia Health, and it's a new one, and it's a lady who, I'm not sure who she is, and she's telling all pregnant women at whatever, no matter what stage of pregnancy you are, that it is completely safe and effective to have this jab. They now have enough data to So, I don't even know if there's any words that...
There's no words.
There are no words.
There are no words. But I'll say some words.
Okay.
Yeah.
Good.
We know, having been in the health fields, I find it extraordinarily upsetting, because this is a narrative now that pregnant women at any stage of pregnancy has this experimental genetic device with about 6 months of experience, okay? No long-term efficacy or safety data at all. That is an undeniable fact. There is no long-term efficacy or safety data. There is none. 6 months is not long-term. But we still hear the platitudes, safe and effective, safe and effective. It's a platitude, it's dogma.
Yeah.
No long-term efficacy and safety data is a fact. So anyone can question me or pull me through the coals on that. That is a fact. Yeah. We used to lament about giving a Panadol to a woman in the first trimester of pregnancy. Not that long ago. Really look at the pros and cons. Does this woman really need this? Now they're saying, now you're fine. In an almost laissez-faire way, you'll be right, mate. Just go and have it. You know, forgetting that the risk of this, whatever you call it, is, I'm not saying it doesn't exist, but it's so small compared to the potential damage that's going to be done. And now they're pushing it on children, not here yet, but wait. But, you know, obviously overseas.
We've had 2 cases of children testing positive, and that will lead beautifully into the narrative of, okay, let's start doing it from 12 up. Which is what's happening in Canada. It's what's happening in the US. Yeah. But I think the UK.
Well, you know, they've been doing trials on babies as young as 6 months, and I heard, and I don't know exactly, but I heard they're going to do them on newborns. You know, even the CDC says that the, you know, survival rate of children, if they get this virus, is something like 99.997%. Now, if you have an epidemiologist watching, you know, correct me, but it's around that. We know it's exceptionally high, but, you know, obviously the narrative's changing. But the push is overseas is massive, to the extent that in some states of America and Canada, I believe, 12-year-olds can now give consent without any family background to have this. And we've heard the stories about luring kids with ice creams and all of that. This whole rollout is like an election campaign with cheap bribes. Like, when have we ever seen that before? What is that? And I've even read things that, you know, medically, we can never advertise things. Well, you mentioned some medications that have been proven to actually treat this disease quite well, but you can't mention it. Yet it's okay to advertise these things now. That's okay. And also little bribes are okay. That is unheard of. Absolutely unheard of. I just, you know, if people don't see that.
I actually looked up, I actually Googled, and if any of you want to do this, I highly recommend it. Google, I did something like, I'm taking part in a drug trial, what should I know? And you will have page after page after page come up of the fact that, yes, you know, they can cover your expenses, but they can't give you, you know, there's all this there's all these rules and regulations. There's all this information there about informed consent, what you need to know, what you need to be told. And here's the thing. So anybody that didn't watch part one, I used to work in research, and we used to run drug trials. And of course, when we signed somebody up, it did take longer than 10 minutes, and we did make sure they had informed consent. And what we also did was we had a clinic that they would come to once a fortnight. I can't remember, once a fortnight, once a month. I'm pretty sure it was once a fortnight. We ran a Friday morning clinic where everybody that was on the drug trial came in. They had bloods, they had blood pressure, they had their weight taken, they had all this sort of stuff. And every single cough, every single fever, every single time they farted, it was documented down on the paperwork so that we knew what side effects were occurring in this. Now, given that these are trial drugs, given that until 2023, they are all in experimental phase. You can find that out simply by going to the websites of the different companies. Who is keeping an eye on side effects? Who's doing follow-ups?
Well, exactly. And they do say that. The companies say they're investigational. You know, that's the term that they use. So that's a fact. Well, the interesting thing is if they're pushing this for every person on the planet, and they're going to push for every person on the planet, there is no control group. Therefore, there's no trial. So forget the whole 23 trial thing. That makes no sense at all. You need a control group for a trial. So that's just, I don't know. I'm not a scientist. I'm not a researcher.
Not having you, and really, if you're going to look at it, there's a great video that I saw yesterday of somebody who's looked up one of the sites, and I don't know, it could be the AZ one, and their own recommendations are not to be given to somebody that's taking any other medication, not to be given to somebody that, you know, there's all these, not to be given to somebody who's pregnant. There's one that says do not have any sexual activity for the next 30 days because we don't know the effect that it could have on, you know. So they've actually...
But okay to give to babies and women in the first trimester.
There's a disconnect somewhere between the information, and I think this is what's most confusing to people who are unsure. Where if depending on where you turn, you're going to get a different narrative. And so people are kind of choosing the narrative that suits what they kind of are already leaning to. It's almost like people are a little bit like looking around for guidance that they've always maybe had, and it's not there.
Yeah. Look, you know, we always just have to come back to a good risk-benefit analysis as best we can. But there are so many unknowns. That's the thing. There are so many unknowns. But, you know, that itself is a fact. There are so many unknowns. So, you know, that needs to be taken into the equation. So I think the message is people be informed as much as they practically can. And the decisions, as you say, it's from the gestalt as well. It's not just data. It's, does this feel right? Does this feel right?
I loved your definition of, so we're about 5 minutes from the hour. I'm going to keep it to the hour again, just because then I can make sure it saves. Sometimes if it's over an hour, it doesn't save. And I want to let you know that it's the last 5 minutes to see if there's anything you want to say that we didn't cover. But I loved your definition of intuition. Can you remind us again of what it is? What was your definition of intuition that you said before? Because I love that.
Knowing without thinking.
Yeah.
And
Yeah.
it's really the heart and lead. So heart and mind are meant to work together. Obviously, the mind's useful and the left brain's useful, but not when it's out of balance.
Yeah.
So left and right brain need to be in balance, and heart and mind need to be in balance with the heart on lead. So, you know, the mind implements the heart, or the brain, mind, whatever, implements the knowing from the heart. And that's really how we're meant to work. And when we hone in, and I'm not pretending I'm an expert at this, not at all. It's definitely a work in progress for me. But when we more home into that real intuition, we're more connected to the field. And that's really the name of the game, isn't it? Because I trust the field. I trust nature more than the hubris of the collective institutionalized intellect that's saying this is how it should be. And, you know, that's got to stop. The intellect is fine. It's very useful, but it's got to be in proportion. And I trust the field more than data on studies. So, yeah.
Yeah, I love that. I love that. Well, is there anything you wanted to say in the last couple of minutes that you feel we didn't cover, or that you just want to round up on?
It's always nice to leave an uplifting message as best we can.
Yeah.
And I've had to dig very, 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 very deep to find some, because it's hard to witness what's going on when when you're not necessarily in the majority, and you're looking at this and thinking, wow, is this really unfolding? But, you know, crises have a function, and they happen when we ignore the previous indications and cues. And they can happen on a small scale or a massive scale. And this is a massive crisis for humanity, but it is to break down old systems, institutions, beliefs, thoughts, lifestyles that did not serve us well. And we know a lot of it didn't. So it's to change that, and to say, well, if not that, now what? And that's the scary bit, actually, because a lot of us are afraid of freedom and autonomy and sovereignty.
We're in the free fall at the moment, aren't we? We've
and
we're in the free fall, and we're in the now what phase.
Yeah, exactly. And I think that, you know, advice I would give, and I'm sure you have plenty to do, is as best we can stay centered in our own being within the storm, and see it like a movie unfolding. Look after ourselves, our loved ones, but stay centered and grounded, because it might get rockier. It really might.
Did you think you'd ever be this far into it and say it might get rocky? Look how well you've already adapted. I mean, I really want to say congratulations to all of us, because look how well we are doing. I mean, some days I think we're doing extraordinarily well just to be standing still. So, you know.
I agree. And I said ages ago, there will be a new normal. We just have to be very careful what new normal we agree to.
Yeah. Which
one we choose. And the name of the game is to take the red pill and get out of the matrix, if I can use those terms. Well, I'm serious.
If you are the doctor in the new normal, I'm happy to subscribe to that. So thank you for joining us.
Thank you.
I really appreciate it.
It's been a pleasure. Thank you so much. It's been great.
Yeah. Really appreciate all your time. All right. And
thank you.
Where can people, what's your website? Is it?
I'm so not techie. It's www.drcatherinefyans.com is my website.
Okay. And people can find you there, but also your book is available wherever books are available. So thank you.
Yes. Again. Yeah. Okay. Pleasure. Bye-bye.
All right. Take care. If you click out, then I'll, if you click out on your square, and then I'll just.
Cool. Okay.
Great. All right. Thank you. Bye. All right, everybody. Thank you so much for joining us. As you know, your comments don't save. So if you have any questions, anything you wanted to say, anything we didn't get to, just pop it in the comments below, and I will save this. Thank you for joining us again. There's a part 1 that you can find. I will reshare that in my stories if you missed it from last time. All right. Thanks, everybody, for being here. Really appreciate, and I hope that you have some starting points to go and explore yourself, figure out what's best for you, be in your power, and make good choices.